Hello and good evening, and welcome to another episode of our Making It Plain series of town halls. Tonight, we at the Black Coalition Against COVID are so excited to partner with our brothers and sisters in the union and movement as we honor and celebrate and provide information to all of the workers out there in our land who need and require and deserve good information. My name is Tucson, and I'm a co-founder of the Black Coalition Against COVID, an organization that is based in the grassroots community efforts to fight this pandemic in Washington, D.C. We're also a national coalition that includes the 4 historically Black medical schools, Howard University, Meharry, Morehouse, and Charles Drew University in L.A., along with the National Medical Association, the W. Montague Cobb Institute of the NMA, the National Black Nurses Association, the National Urban League, and our partners who are producing this show for us, as always, tonight, BlackDoctor.org. We're also happy to be a part of the Made to Save program of the Department of Health and Human Services. We are understanding and aware that many of you in this audience tonight and many of your friends and family are either hesitant or resistant to thinking about taking the vaccine or being vaccinated against COVID-19. Many of you are working around colleagues who also may be hesitant or resistant, or many people in your families. It's okay to have questions, and especially tonight, because we have the experts who have the answers. We've been polling workers for several days, collecting the questions that you want to have answered. And we're going to answer as many of them as possible in this jam-packed and information-rich show tonight. We encourage you also, though, to use the chat feature to ask your own questions, and we'll try to get to all of those as well. Well, to begin our show, it is my great pleasure to introduce Trey Baker, who is the Senior Advisor for Public Engagement at the White House. Trey, welcome.
Hey, Reed, thank you so much for having me on, and thanks to the Black Coalition Against COVID. Y'all have been just such great partners for such a long time. I'm really happy to come and bring greetings from the Office of Public Engagement. One thing I was laughing about before we came on, Reed, was that the first time that I talked to you, I remember it very vividly because I was in my makeshift office in my guest room in Mississippi. And now I'm coming at you live from the White House. And so that just goes to show the work that's been put in by organizations like yours, this coalition that you've been able to build. And then all the work that's being done by my so many of my colleagues who you'll hear from tonight, including Dr. Nunez Smith and Dr. Cameron Webb, who will come and greet you over the course of time. Just very briefly, I just wanted to say, the work that the Office of Public Engagement has done, whether it be the month of action that we're towards the end of now, where we've had over 600 organizations to sign up and do activations over the course of the month, or if it's building towards celebrating independence, which we're doing at the end of this week by having a celebration of our first responders and those folks who are essential workers, like we'll do on the 4th of July here at the White House. It has been a whole team effort all across the board. And it's only right that it's these groups that come together tonight, this combination of folks, the Black Coalition Against COVID, the labor unions, the activists who we have here, because without that group, that's the Joe Biden, Kamala Harris coalition. And so it's so important that we come and we give information to this group, because this will be the group that ultimately puts us over the top when it comes to uptake of vaccinations, and when it comes to making sure that we're protecting people, making sure that we're protecting our workers, and making sure that we're moving forward from here. And then beyond COVID-19, because we will move on, we will go to that next step. It'll be the same coalition of people to push forward on infrastructure and make sure that the American Jobs Plan and the bipartisan framework that the president just announced will be able to come to fruition, so that we can rebuild the infrastructure, the roads and bridges, the broadband. It'll be this coalition that pushes forth with the American Families Plan and make sure that human infrastructure that we have in this country is solidified and safe. It'll be the same coalition here that takes and runs on the mantle of voting rights and police reform and on all those very important things that we need to get done. And so I just want to thank you, this whole coalition, labor unions, HBCUs, hospitals, healthcare systems, for doing the work that you do. And I think it's going to be a great show tonight, and we really appreciate everything you've done to get us this far, and we'll all celebrate together when we get over the top.
Thank you, my brother. We really appreciate it. Thank you again. And now it is my distinct pleasure to introduce an important and an inspiring leader in the union movement, President Everett Kelly, who is the national president of the American Federation of Government Employees and is also as a member of the executive council of the AFL-CIO. This is a time for leadership, and Everett Kelly is a leader. Welcome, President Kelly.
Well, thank you, Dr. Tucson, to all the panelists, to all of those participating on behalf of labor. Good evening. On behalf of the more than 700,000 federal and DC government workers represented by my union, the American Federation of Government Employees, or AFGE, I'm honored to be participating in this important town hall. The group of panelists tonight includes so many physicians and experts on COVID-19 response that, I'll not even try to address the medical issues. I'll try to instead to address the issues from a labor perspective. And to that end, I try to give what little information I have on what we do know about, Black workers in America who happen to be unionized. First of all, we should know that Black workers are far more likely than workers of any other race or ethnicity to be unionized. The most recent data are pre-pandemic data that don't reflect job losses in the hospitality industry and other services industry that have been hit hard by job loss over the last year and a half. But pre-pandemic, 14.2% of Black workers were unionized, as compared with 12.3% of the entire workforce. And the composition of the Black unionized workforce is not what many people who think of unions are, as mostly representing industrial workers or construction workers. In fact, Black union workers today are more likely to be female, older, or even more years of formal education, be immigrants, and work in the public sector. That's mostly what the Black unionized workforce look like. And that's true in many unions, and it's definitely true in AFGE. Nevertheless, in spite of enormous concerted efforts by all unions to encourage and incentivize and sometimes arrange for the employer to provide the vaccine directly, we still see refusal. Some call it hesitancy. And that is the optimistic way of describing the problem. But I tell you that, hesitancy amounts to refusal at this point. The federal government is the employer of the majority of AFG members, and the federal government is not mandating vaccinations. The federal government has not, and as I understand it, cannot mandate the anti-COVID-19 vaccine because they have only emergency use authorization from the FDA. I'm sorry. I've heard this fact used as a rationale for refusing the vaccine. The very concept of emergency use conjures up our community's memory of experimental use and the horror of Tuskegee and James Marion Sims. But we also deal with lots of rumors and mistruths and continue to spread about the vaccines and not, at all confined to the Black community. I've heard AFG members say that they won't take the vaccine because it causes infertility. I've heard AFG members say that the vaccine fills your body with heavy metals and make you magnetic and increase your risk of MS and Parkinson's and Alzheimer's diseases. I've heard FG members say that the vaccine actually gives you a mild dose of COVID-19, and since Black people have higher morbid, risk from COVID-19, they're better off protecting themselves from any infection at all. And I've heard, I hope I get this right, I've heard the word that since the COVID-19 vaccine uses mRNA technology that affects the genetic material to cells, it will actually alter DNA. I found this under little knowledge can be a dangerous thing, right? I found that. And I heard this week from an AFG member who was refusing the vaccine that she thought the vaccine themselves was giving rise to the variants that experts are warning are even more deadly than the virus that the vaccine is supposed to be protecting us from. And finally, I think most difficult to answer is the argument that what's the difference if I get it or not. I still have to wear a mask everywhere. I still can get COVID and die from it. I still have to worry about giving it to other people, and no one knows the long-term effect of the vaccine. I also can tell you that what I do not hear. I don't hear anyone complain about the lack of access at this point. The federal government and most unionized employers that I've read and heard about are providing paid time off for getting vaccinated and even providing help with transportation to and from a vaccination site. There are a few problems I've heard about regarding paid time off after a shot to recover from reactions. Logics, therefore, don't seem to be the problem. Logistics, rather. Finally, I want to emphasize that, it's hard to generalize about who in our community, I refer to the Black unionized community, is not just people without a lot of post-secondary education. Levels of education do not seem to be the deciding factor. I want to close by acknowledging that vaccinating Black people is a matter of highest priority for FGE and unions generally. And I hope that my description of the rumors, doesn't give anyone the impression that Black workers themselves are the cause of their own risk. We're well aware that Black people were hit disproportionately hard by COVID, not only because of the racism that pervades our medical system, but and not only because Black people are more likely to have heart attacks and diabetes and respiratory illness and HIV, and thus have been more likely to have complications or die from COVID than others. It is also because Black workers are more likely to have to work in places where viruses of all kinds spread, in the prisons, in the nursing homes, and restaurants and stores. My own members in law enforcement, healthcare, and support for the military are all in jobs that increase their risk of infection. My union represents workers in all of these settings, in hospitals as well. And while all of the doctors here know that, hospitals have been quite successful in setting up protocols and do protect hospital staff from infections, Black workers are often the workers who are last in line for PPE at a hospital. Black workers are quite often the housekeeping staff, the laundry staff, the people at the desk greeting the public and making appointments. Black workers cleaning and fixing the HVAC system and the elevators and the boilers. They have less of a chance for protection, no chance at telework, and every opportunity to hear misinformation about risk. I want to thank the Black Coalition Against COVID for holding this event, and so I look forward to learning tonight from all of the panelists. Thank you for having me.
Well, thank you so much. And we'll be hearing from you later in the show. And we also have a special surprise for you. And that is we'll be playing a video that you've done at the very end of the show. Let us also know that this program is sponsored by the SEIU, AFGE, AFSCME, USW, AFL-CIO, DC, CBTU, UFCW, and Unite Here. All of them have come together. And so we know that there are going to be people of many different ethnicities joining us tonight. And we hope this program is useful for everybody. Now it's my pleasure to introduce one of my sheroes in this fight to save Black and indeed all lives in this pandemic. Dr. Marcela Nunez Smith, the senior advisor to the White House COVID-19 response team. This is a conversation that I'm eager to have with Dr. Marcela Nunez Smith. Thank you so much, President Kelly, for those remarks. We really appreciate your leadership and your participation on the show tonight. But now it is my pleasure to introduce one of my sheroes in this fight to save Black and indeed all lives in this pandemic, Dr. Marcela Nunez Smith, who is the senior advisor to the White House COVID-19 response team and someone who has been working tirelessly to try to get control over this pandemic. Welcome, Dr. Nunez Smith.
Thank you so much. It's great to see you. Let me just echo and say ditto to you. Thank you so much, Dr. Tucson, and to the entire coalition. Really, this is everyone, all hands on deck.
Terrific. Well, listen, we are now at an interesting stage in this pandemic. And from your estimation, are we close to the end yet?
Let me tell you, I want that to be so. It's absolutely true. The light is there, and it does get brighter. I think there is a lot of cause and reason for optimism. We have vaccines that continue to be really effective, hundreds of millions of doses given safely. We're seeing signs all over the country of reopening. But there is a note there. We are still in a choose our own adventure scenario and situation, we are watching closely, for example, variants. That's really important. I'm sure something we'll talk more about tonight. So, yes, lots of reasons to be hopeful, but we are not at the end yet.
Well, you mentioned variants, and so let us go ahead and talk about that. First of all, just so if there are a few of members of our audience who may not know what variants means, let's update them very briefly on what we're talking about, and then tell us why are you concerned, and if you're concerned, which ones give you the most concern?
Yeah, absolutely. So, viruses, what they do is evolve, change, mutate, right? They're always trying to get an advantage, really. And sometimes these changes, you'll hear it referred to as mutations or variants. Some of these changes are what we call clinically significant and some aren't. But when they're clinically significant, and in the case of SARS-CoV-2, the virus that causes COVID-19, clinically significant means that they can spread easily from person to person, even more contagious perhaps than the original version, which we call wild type. Also can mean that there's a potential for worse disease. And so those are two things we look at a lot. There are several variants, and there have been people who would have heard about variants identified in different parts of the world. And really importantly, here in the US, substantial resources are going into tracking to try to identify which variants are here. Important to know, we're not able to do that on 100% of cases, but certainly we're watching for a long time. One variant in particular, it's the Delta variant. CDC recently said this is a variant of concern. So that means we're back to that clinically significant, right? And we see with the Delta variant, that's an important one to remember, especially right now, that it is easily transmissible, more so than prior versions, from person to person, higher rates of contagion, and that has the potential for causing worse disease. When we look across, for example, at the UK, Delta quickly became the dominant variant there. And we see younger people really affected, those 12 to 20 in particular. Here, back at home, Delta is very much on track to become the dominant variant here. And let me just be really clear, anything that is more contagious will ultimately cause more people to get infected and more people to get sick and more people to get more ill and need the hospital and other advanced services. So it's really urgent. We see that the vaccines that we use, in particular mRNA vaccines, that's Pfizer and Moderna, they confer a high degree of protection against Delta and all of the variants that we've identified in circulation here. So if anybody's been waiting to get vaccinated, this is the moment. This is a now urgent situation. Delta is here and spreading.
I look across the globe and I'm seeing the Delta or the Indian version not only destroying India, but wreaking havoc, as you mentioned, in the United Kingdom, but also in countries as far away as Australia and also across Europe. As we are tracking that, it really does, I think, give a lesson of caution and awareness for us here in the United States. And so clearly the goal of trying to get as many people vaccinated as possible, as quickly as possible, is clearly the job one. How are we doing on fulfilling the president's goal? And thank gosh for the president's leadership here. How are we doing in fulfilling his goal for vaccinating the American people by July 4th?
Yeah, absolutely. I echo that. The president's leadership, making sure that there was supply to vaccinate the entire country well ahead of schedule. I think people can forget that. And that is so critically important. And making sure that domestic supply here at home stays, it's protected, even as we step up and take responsibility as a leader on the global scene. We know this is a global pandemic. We'll take global solution and global intervention. People would have heard the president set a very ambitious aspirational goal to get 70% of all adults, everybody 18 and over, at least their first shot, by the 4th of July. And as we're coming up on this important holiday, it's great progress to say 70% of those people in the country who are 30 and older have already gotten that first shot or are fully vaccinated. When we look at the holiday, the data are on track that by then, 70% of those 27 and older will have gotten at least one shot or be fully vaccinated. That's really great. We have a vaccine available now for everyone 12 and older. But it's really our young people, and that's who I'm trying to speak to in particular. Those who are 18 to 26, dispel some of those myths that COVID doesn't affect you. We're seeing in our hospitals, younger people getting admitted. We're seeing, quite frankly, people who are struggling with long COVID, those symptoms that just linger and last and can be debilitating after infection. And now we have Delta, which quite frankly is a threat to all the progress that we have made. So more urgent than ever to say, please, 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 please get vaccinated. I've been vaccinated. Everybody in my family has been. It's what we need to do for ourselves and our communities.
Well, I think you just gave the final word on what our message ought to be to the workers of our nation, and particularly our African American and other workers of color. And that is get vaccinated as quickly as possible. Well, thank you so much to our Marcela. And obviously we taped that just about a couple of hours before the show because of her pressing schedule. But now we're very excited to bring back President Kelly, but also Valerie Long, the International Vice President for Service Employees International Union, and Robin Williams, National Member of the Board of Directors and Chairperson for the National Labor Committee of the NAACP and the International Treasurer for CBTU. And let me start with you, Valerie, as we start to think now and understand what has your union been doing to try to help protect your workers from the pandemic generally, and maybe even for encouraging them to take vaccinations as well.
Thank you so much for having me, Mr. Tucson. And as a member of a union and an officer of a union that represents 2 million essential workers in the public sector, in the healthcare, like right on the front lines, in terms of janitors, security officers, airport workers, excuse me, we have been on the front lines since the beginning of this pandemic, and our members did not have the luxury of being able to work at home in Zooms. Our members have been on the front lines and working really hard because they care about their constituents. They care about the work they do, especially our healthcare members who are just heroes in many of our minds. And I know that Robin feels the same way for her members, and all of the labor movement feels that way for our frontline workers. We don't necessarily just want to clap at 7 p.m. We want workers to be respected, paid, and protected. Our union has tried to educate folks both from a standpoint of trusted agents. So, for example, people trust their local unions. So our local unions across the country did mobile vaccination clinics, where a clinic, they'd partner with an agency, the clinic would come up with vaccination mobile units right in the local union's parking lot. We had that case in Los Angeles where 8,000 of our janitors, security officers, airport workers were vaccinated in Los Angeles. We had several educationals and town halls where we educated folks peer to peer. So an African-American doctor talking to African-American security officers, talking to each other and challenging each other around some of the myths, some of the hesitancy, and just challenging each other to get vaccinated. Town halls over the Zoom platforms, thousands of members we pulled together to educate, to ask questions, to challenge each other to get vaccinated, as well as making sure that folks in their bargaining, we are a union, so we have the platform of a collective bargaining agreement. So we bargained into contracts, PPE, protective equipment. We bargained leave for folks so they could go get their vaccinations. We made sure that folks had the opportunity to bargain leave for when their families were sick. So we used every amount of leverage that we had and every amount of getting trusted agents in terms of coworkers talking to coworkers and encouraging them to get vaccinated. Despite that, and this is the cautionary tale, despite that, we have documented over 500 deaths amongst our members. It is a sad thing to have to document, and I don't think we've documented it all. We want to honor our dead, but by the same token, we want to stop the dead. But that's the consequence of us not doing the work that we're doing. It'll be more if we don't, deal with that consequence. And it's a sad story. My granddaughter, who's 18 now, when she was 17, she caught COVID, scared me to death. She had mild symptoms. She came through it okay. It didn't have to be like that, though. She could have been a long hauler. She could have had residual effects. She didn't. To all God's graces, it was enough to scare me. I have people in my family who doubt the efficacy of getting vaccinated. This is not something to play with. What I would say to all of the folks that are watching, and I'm sure we all agree and really want to touch folks, touch and agree, as the word says, that we need to come together and encourage each other to be vaccinated, because that is the way that we can come out of this.
Perfect.
So
thank you
I'm going to leave it there.
much. That is just wonderful. And thank you for sharing your personal story as well. Let me turn to Robin Williams and your thoughts on the matter.
Yes, thank you so much. And thank you for inviting us to be a part of this great session tonight. I want to thank all the doctors, especially the Black doctors, for coming together during this pandemic and just working with labor and other organizations to make sure that we educate our community about this could be very deadly virus. So early on, let me tell you what happened. First, I'm retired, recently retired last April from the United Food and Commercial Workers Union, UFCW. Of course, we are one of the sponsors tonight, but I have been union, I've worked union, and I will always be union. I do represent labor, the labor unions on the national board of the NAACP. Like Valerie said, early on during the pandemic, labor unions came together to educate workers, not just union workers, about this virus, but any worker that would hear them. They also advocated for workers. Now, when unions advocate for workers, union workers benefit, but not just union workers, all workers benefit. For example, the United Food and Commercial Workers Union, they represent grocery store and food processing. The United Food and Commercial Workers Union, they advocated for hazardous pay. Hazardous pay, hazardous pay. The unions jumped on hazardous pay. Most of African Americans and people of color, they are essential workers. So they did not have the privilege of working from home and doing Zoom calls and everything that people complained about, the Zoom calls. They had to go to work to keep this economy going. In grocery stores and meatpacking plants, postal workers, truck drivers, the bus kept going, subways were still moving. And so these are our workers. We moved from really educating and advocating for our workers to protective gear, hazardous pay, extended sick leave to take care of loved ones that were, contracting the virus. And so they went from that to when Biden came into office, and then we had the vaccinations available. Educating how important it is for people to be vaccinated. Many of the unions, including UFCW, they started working with organizations like you and other organizations to help open up clinics in different areas. We had a problem with people of color not being able to register, right? To get on a list to be vaccinated. We worked with the churches, and now it's very open. You can almost walk into a clinic and get vaccinated. So, what we're really pushing is that sooner or later, we got to get back to work. Everyone wants to get out of their houses. They want to go to the parks. They want to go to the movie theater. They want to be able to shop freely. They don't want to wear a mask. Well, sooner or later, you want to go to that normal. Sooner or later, we have to go back to the workplace. Now, our workers have been in the workplace. They are vaccinated. We believe over 80% of retail workers, grocery store workers are vaccinated. We're helping more workers in different industries, including meat packing, to become vaccinated. Recently, the UFCW, they did a couple of calls with Dr. Fauci, just to continue to educate the members and workers about the importance of being vaccinated. The doctor that was on earlier, she talked about the Delta variants. It's not over. The pandemic is not over. We're coming out of it, but we must be very cautious about how we go back to what we believe will be our normal. And doing that is extremely important, that all of us get vaccinated to protect ourselves, but to also to protect our loved ones as we try to move back to our new normal.
Oh, thank you for that. And as we close out this first panel, Dr. Kelly, let me just ask you, sir, for a quick word on when you are interacting with your peers at the top leadership level of our unions. What's the conversation there from them? What do they want their members to hear and understand?
Well, one of the main, in my opinion, one of the main subjects of is the loss of, the fact that PPE wasn't readily available throughout the nation. We felt that, our government failed us, right? Because of the inadequate supply of PPE. That became one of the main topics of discussion throughout the labor movement.
Understood. Well, listen, we have a last word from you, President Kelly, at the end of the show. So stay tuned for that. And we want to thank all three of you for bringing us this panel and these perspectives. It's been just wonderful. Thank you so much. And now I'm very pleased to bring in a very special expert for us. Dr. Dimitri Descalakas is a very important person in this whole fight because he is the Deputy Incident Manager for COVID-19 response at the Centers for Disease Control. And we really have some very important technical questions to ask you, Dimitri. And let me just, first of all, thank you so much, sir. And start with the first question, which is, many people do seem to be and are remaining uncertain about what vaccinated people can do and what the limitations are for unvaccinated people and what they should be following. Help us to understand what can vaccinated people do and what shouldn't unvaccinated people do.
Great question. And Dr. Tucson, thank you so much for having me. Always a pleasure to see you. I'm really excited to be a part of this broadcast. So fully vaccinated people can resume activities without wearing a mask. I think we heard a little bit about that in the last panel, or doing physical distancing. Now, of course, unless it's required by federal, state, local, tribal, or any territorial laws, rules, and regulations. And of course, local businesses and workplace guidance can also still mandate mask wearing. But other than those scenarios, if you're fully vaccinated, you can resume activities that you did before the pandemic. So really pushing toward that normal. Here are just some examples of some activities that you can do with the mask. So you can go to the barber or hair salon. You can go to a crowded outdoor event like a live performance. I am, for one, a live music fan. I'm so excited. You can go to a parade or sports event. You can go to indoor movie theater, attend a worship service, or sing in an indoor chorus. Things that were so normal, but not that we haven't done for so long. You can eat at an indoor restaurant or bar, participate in indoor high-intensity exercise. Now, I do want to remind you that masks are still required on planes, buses, trains, and other forms of public transportation traveling into or within or out of the U.S. and the U.S. transportation hubs like airports and other stations. The other thing is that if you've been around someone who's had COVID-19, you don't need to stay away from others. That means no quarantine or get tested unless you have symptoms. However, if you live or work in a correctional or detention facility or a homeless shelter and are around someone with COVID-19, you should still get tested even if you don't have symptoms. So for most people, that is a change. But for individuals who are working in those very special conditions, different guidance. For unvaccinated people, including children who are 2 years and older, masks should be worn in addition to staying at least 6 feet apart, especially when indoors, or around people who don't live in your household. So remember, unvaccinated persons should wear masks to completely cover the nose and mouth and fit snugly against the sides of face without gaps. So again, it's a choice to be vaccinated or unvaccinated, but there are definitely some pretty serious perks from the perspective of getting life back to a more normal.
So
if you get vaccinated.
So one of the things I think that a lot of people miss here is that all the things you can do if you're vaccinated. But what they don't hear is if you're not vaccinated, those things don't apply to you. And I fear that so many of our workers are going to be exposed to people who are walking around without masks, but who have not taken care of the first part of the statement, if you're vaccinated. What do you say, though, to those who are fully vaccinated if they're still uncomfortable with the new mask guidance, particularly as we are hearing about things like the variants?
Another great question. So our guidance is really based on available science. And over the past few weeks, we've been seeing some really important evidence that vaccines work. So we know we have data that they work, but in real life now we see that cases have continued falling dramatically, and a growing number of studies are really showing three big things. One, again, real world, not like some clinical study, real world evidence that our vaccines are working. Studies show them to be over 90% effective in these real world settings, 90% in preventing mild and severe disease, hospitalizations, and death. So really critical. Our vaccines have also been proven to be effective against the SARS-CoV-2 variants that we're hearing about circulating in the country. So as everybody, Dr. Nunez, Smith, and others have said, this is the time to act. So we know that the vaccines work. And by creating this sort of wall of immunity, we prevent the spread of this variant, the Delta variant that we're concerned about, as well as others. Also, if you're vaccinated, the other really good piece of news is that you're less likely to spread the virus. There's a growing body of evidence suggesting that fully vaccinated people are less likely to have asymptomatic infection and to be able to spread SARS-CoV, so the virus that causes COVID-19, to others. So when you put it all together, that's pretty good evidence to back up our mask guidance. It's encouraging and shows that vaccinated people are protected, less likely to carry the virus to others. So with all this evidence in mind, we're still sticking to that guidance that vaccinated people no longer need to wear a mask. So I think that again, one of the comments that we heard before was about hesitance. And so we always like to flip that into confidence. And the way to create confidence is to just be really transparent of what we know. This is one of the things that we know. And right now the data really supports the strategy. So vaccinated people approach normal.
Thank you so much, Dimitri. We really appreciate it. We're going to move into really answering some very specific questions that workers have had on the science. And you're certainly welcome to join us. I know you have some other commitments, but as you go off, one just sentence, if you could, what is your, I think you've said it, but I want to make sure we get it. And that is, what do you say to the workers out there right now?
So, COVID vaccine is effective at stopping the pandemic. And getting vaccinated brings all of us closer to normal. It protects you and it protects the community. It's important that essential workers are vaccinated because your role is critical and your health is important. So you maintain infrastructure, you maintain the work that lets society roll. So you need to be healthy and we need to make sure that you have the tools. I think we've already heard that access has become a lot easier. Go to a pharmacy, go to a clinic, but really it's about asking you to be an ambassador for yourself and also being an ambassador for those that you work with, your friends, and your family. Getting that COVID vaccine gives you an added layer of protection against COVID-19 and protects you and the folks around you. So the bottom line, one sentence, get vaccinated.
Thank you so much, Dimitri. Stay as long as you can, but if you go when you have to, I understand, because now we're going to bring in three key of our workers. First of all, I'm really excited that we're going to be joined now by Mr. Robert Hollingsworth, the president of AFS CME District Council 20, Ms. Juanita Bowman, union liaison and head shop steward for Kaiser Permanente OPIU Local 2, and someone who I've been working with and been excited to work with, Mr. Gerald Williams, who is operates the subways in the Metro DC area and the buses, and he's been a frequent advisor to us at the Black Coalition Against COVID. And to answer their questions and many others of yours in the unions, I'm really pleased to bring in Dr. Peter Marks. Dr. Peter Marks leads the FDA Center for Biologics Evaluation and Research. Simply put, when you see a decision is made about whether or not a vaccine has proven to be safe and effective and available to the American people, it is Dr. Peter Marks who is leading that effort. So any questions about the vaccine, this is the guy. In addition, we have Dr. Lisa Fitzpatrick, the CEO of Grapevine Health and a member of the Black Coalition Against COVID, Dr. Melissa Clark, CEO of the BHE Group, and again, a member of the Black Coalition. Let me start with you, Mr. Williams, and be able to hear from you. I know that you operate subway trains, and as such, you're regularly engaging with the public. What are your thoughts and concerns at this stage in the pandemic?
Hey, how you doing? Can you guys see me okay?
We don't see you, but we hear you well.
Okay. I guess I can start off with one of my concerns mostly is right now where we stand statistically in this pandemic, and how not so much as just where we stand, but also how safe really is it right now at this very moment in this pandemic, especially when it comes to children and stuff in that of that matter.
Great. And by the way, Mr. Williams, we're going to come back to you on that children issue a little bit later, because I know that you're a parent and you're sort of thinking about that. Mm-hmm. But in terms of this question about just really how safe are we right now, let me ask Dr. Melissa Clark to start to think about how we will respond in terms of where we are at this moment in the pandemic.
Well, good evening to all my fellow panelists and Dr. Tucson. Thanks for having me. So that's an excellent question. And I think it's really important, first of all, to understand, just as Dr. Marcela Nunez Smith mentioned, that even though we are doing great in terms of our vaccinations and almost 70% of individuals over 30% have gotten one dose of the vaccine, the Delta variant poses a significant risk, especially to the people who are unvaccinated. And so as we start to see places open up, and people walking around with masks, and we're not clear who's vaccinated and who's not vaccinated, it's especially important to get vaccinated. One thing that really concerns me in terms of a statistic that I saw from the Kaiser Family Foundation is that African Americans, only 33% of African Americans are fully vaccinated. For Hispanics, it's 38%, whites 46%, and for Asians, it's over 60%. And so those numbers really concern me, especially as we're talking about Black and brown workers. We've heard many times tonight, 80% of the workforce of those who are at the front line are Black and brown workers. And so we're especially concerned when we hear those numbers. So we're definitely not out of this pandemic, and it's important for everyone to consider getting vaccinated.
Dr. Fitzpatrick, let me just quickly ask you, as you hear Dr. Clark talk about how few, relatively percentage-wise, people of color are vaccinated, what is that going to mean down the road?
Good evening, everybody, and thanks so much, Dr. Tucson. It's a great question. I think what it means down the road really depends on what we do. Those of us who are fully vaccinated, I think we actually can be less concerned about the Delta variant. I think it's something we need to keep an eye on. But my concern for the future is what happens if we continue to have such low levels of vaccination, such as we just heard from Dr. Clark. So the future, what happens in the fall, whether or not there's going to be a surge, really depends on those of us who are not vaccinated, getting the information we need, getting comfortable with vaccination, and doing whatever we can to make sure that we are protecting our families, ourselves, and our communities by getting vaccinated. I know we're saying that a lot tonight, but it really is the single most important thing we all need to be doing to ensure that our fall and our winter is not consumed with being indoors, being consumed with wearing masks like we were last year. So I think it's a great question, Dr. Tucson, but it's to be determined because we all really have to do our part and get vaccinated.
Thank you. Let me turn to Juanita Bowman. And Juanita Bowman, you are dealing with a very critical sector of the workforce. Those are in our hospital systems and healthcare. What's on your mind, and what are the kind of questions that you have or that your members are expressing? And you might have to go off mute if you're talking. Oh, she may be frozen there. All right, we will come back that way in just a moment. And let's move then to Robert Hollingsworth. Robert, you again are someone who represents people who are really on the front lines out there. Talk a little bit about the employees that you are representing and what kinds of concerns and thoughts that they have.
Yes. Thank you, Dr. Tucson. And I want to thank you and the coalition, Black Coalition Against COVID, yourself, as well as Dr. Clark, your assistance and your support in our efforts to move our sanitation workers up in the vaccination tier in Columbia. AFSCME represents several groups that are on the front lines. We have sanitation workers who are on the front line. We also have social workers who go out to attend to families who are in need. We also have bus drivers, school bus drivers, who move back and forth special needs children in the public school system. So we had all of these people on the front line, and they were very much concerned about being carriers and taking this illness home to their family members. And with the help of the Black COVID, what we were able to do, because our people, like our sanitation workers, were not included in the pyramid. They were scheduled to start getting the vaccine here in the city at some point, along with just everybody else. But actually, their jobs, sanitation workers, and some of our workers who are going into homes. If you look at sanitation work, for instance, it's one of the top 5 most dangerous jobs on the planet, not just the United States. And they're constantly exposed to toxins, to all kinds of diseases. And when we thought about it and we looked at it, one of the things that Dr. Martin Luther King Jr. said was that this society had to grow to respect the work of the sanitation worker, because in the end, if the sanitation worker did not do their job, then disease would be rampant in their society. So we felt that they deserved to be moved up higher in the tier of vaccination. And the city of Washington was able to make available to our sanitation workers the vaccine, which we were very grateful for and appreciate your support. But they're concerned about the city reopening as well. Those of our members who are now being asked to come back into the workplace, are other people? Is everyone going to be vaccinated? Will we have workers in the workplace who have not gotten their vaccination? Will I be a carrier? If I happen to become a carrier again, am I going to infect my family? The whole conversation around the Delta variant really has raised a lot of concerns. And we just try to talk with our workers as often as possible about it and try to provide the kind of support and encouragement.
Well, I tell you, one of the things that I hope every American would at least learn from this pandemic, and that is that we have a moral and ethical responsibility to the people around us. These workers that you represent, Robert, and you are so articulate in describing and bringing to us, if we are not going to be vaccinated, at least wear your mask so that you don't sicken one of them. I mean, this is just basic humanity, the way a human being treats another. And I just find it outrageous that there are people out here who feel that they can treat other human beings with such disregard, treat their lives so cavalierly. And as you said, Robert, these people go home to their families. And as you said, and I think the thing that I'm going to take from your remarks is the fear that these folks have when they go back home. Well, one of the reasons that people are hesitant to get vaccinated, we hear Dr. Peter Marks, is that they don't understand how were these vaccines developed so quickly. Can you please give us the information about how was it that we were able to produce safe and effective vaccines so quickly?
Yeah, so thanks very much, Dr. Tucson. Thanks for having me tonight. So a couple things happened. First of all, the vaccines were developed off of a platform for vaccines that was already known. So for these mRNA vaccines, it was something that had been used previously. And then as they were developed, they were put forward in a way that was not cutting any corners, but where all of the dead space that we often have in vaccine development, time that's spent not adding value, was taken out. And so the trials were done kind of 1, 2, 3, as opposed to starting and stopping like we often do. And at the same time that the trials were going on, the manufacturing scale up, which is a really important part of what happens, the quality manufacturing has to be scaled up. That was done at the same time. So while the clinical trials were going on, the manufacturing process was scaled up and actually vaccine was produced. So at the end of the day, we had the availability of vaccines that met all of our standards that we would like to see for quality, for effectiveness, and for being safe in a much shorter time than we normally would. Now, for safety, yes, we normally like as long a safety period as we can have. And in this case, the way we're getting some more of that safety data is by watching in various safety surveillance programs after the vaccines have been deployed. But people should rest assured that these are pretty close to the same vaccines in terms of the information that was provided to us as our licensed vaccines.
Great. And so one of the things that's important, and I know a lot of people are asking about, and it's very pertinent to some of the conversations that will happen later, is when will there be the full approval of these vaccines? And I think a big part of that answer, Peter, must be that this long tail of surveillance that you've got that gives you the data and information. Is that correct?
Yeah, that's exactly. Some of that is what we want to have a long enough amount of follow-up data, but we're actually now in a place that you may be aware that 2 of the manufacturers have started the submission of their biologics license applications. And we're hoping in the next couple of months to actually be able to approve at least one of those. And by the end of the year to have hopefully even more than one approved.
Great. And one of the other questions that many of our workers have asked in preparation for this show was the process of the clinical trials that gave you the data about whether these vaccines were safe and effective. And what they wanted to know was, were people of color adequately represented in these clinical trials? Do these studies represent us?
Yeah, so one of the really great things about these trials is they're going to set a new standard, because about 10% of the people in these trials characterize themselves as Black or African American, and about a quarter characterize themselves as Latinx. So we don't normally, let me just so that may not be an absolute perfect representation of our country, but it's a heck of a lot closer to a cross section of our country than we often see in clinical trials. So I'm happy to say that we think that there was pretty reasonable representation there. I think it actually may set a new standard for what we're going to come to expect in the future.
Great. Well, as I want to get to Robert and Jared. I think Ms. Bowman may still, if she's coming back in, I hope, because we really want her voice in this conversation. But is there a question that Robert, you or Jared want to ask our experts, either something that is on your mind or something that your union colleagues have been asking? Let me turn to you, Jared, first, and see what you have.
First, I like how you was talking about the I guess the new Delta variant that's out there right now, and that's a huge concern over here on this side of public transportation. We just lost a member, and it happened very quickly. I think the 23rd was his last day at work, and by the 28th he passed.
Wow.
So that's a huge concern for us because it was so quick. But I think our question is, because we have elderly people and people with different medical backgrounds, who should not get vaccine and why?
Great. Dr. Clark and Dr. Fitzpatrick, who wants to take that?
So there's only one clear category of people who should not get vaccinated, and those are people who are allergic to the ingredients in the vaccine. And the ingredients for the vaccine are listed at the FDA's website. So those individuals who might have a history of allergy could check on those. But those are the only people. For people who have a history of underlying illnesses, those are the very people who are most at risk for COVID-19 and having a poor outcome, meaning ending up in the hospital or dying. And so especially those individuals should get vaccinated, because we're seeing again against the Delta variant that the vaccines are 90% effective and in preventing severe death or severe illness and death. And so I think that should be one of the main messages, if you can get to your constituents, that if you're elderly, as you mentioned, or you have a pre-existing condition, vaccination is really the best bet for protecting yourself against COVID-19.
And Dr. Fitzpatrick, any other comment?
Yeah, Gerard, I will just add, I want to reassure everyone that protocols are in place at all of the vaccine sites, so that if, someone does have a reaction, there's someone there immediately to attend to the person. And so the beauty of the body's response when there's an allergic response, or you come in contact with something you're allergic to, is that it's actually pretty immediate. And so that's the reason we have to wait 15 or 20 minutes after the vaccine, because we're waiting to see if that reaction will happen. And if it does occur on the spot, someone is there to help. So even in the event someone has an allergy, but they don't know about it, I'm confident that someone will be there to rescue them. So I don't want people to have that concern.
And one of the things that I think that comes out of this is a lot of people ask, what's in this vaccine? People think this is a big mystery. I don't know, Peter, Melissa, or Lisa, who wants to take, what's in the vaccine?
So all of these vaccines, one way or the other, are helping the body to make a mimic of a part of the SARS coronavirus 2, the virus that causes COVID-19. And there are different ways you can kind of get to that, making that mimic that part of the virus. And so the mRNA vaccines do it by providing a message that allows the protein to be made, and then it's presented to the body, where the body makes an immune response. There are also the Janssen vaccine that uses a virus to get in some DNA that does the same thing. It ultimately makes the protein. And at some point, we'll probably even have just plain old protein vaccines that do the same thing. But in the end of the day, really, all of this is doing is mimicking what would normally happen in nature, which is your body gets exposed to something foreign that potentially could cause harm, and your body makes an immune response at it. What we're doing here is, some people think that vaccination is some kind of unnatural process. It's not. Our bodies make immune responses every day to many different things. If you have a 3-year-old and they went out to the playground today, they're probably making an immune response to some of the dirt they ate on the playground. And believe it or not, they probably did eat dirt. That we know that that's part of the normal 3-year-old diet. And that's normal. And so that's what's happening here. This is nothing. This is nothing magic. It's nothing that we should get too crazy about here. Yeah. But it is something, to go back to Mr. Williams, if we care about each other, if we really, people ask, what can I do if I care about my neighbor? You can go get vaccinated. And if you're not going to get vaccinated, you got to wear your mask all the time. But
Peter, let me be clear. Is there, I'm going to come back to our other guests in a second. Peter, is there a robot chip in the vaccine?
There are absolutely no robot chips in these vaccines. And I can tell you that we have a group of inspectors at FDA, and this is serious. These are people who take their jobs really, really seriously. Their job is to make sure that these biologic products are what they say they are. There are no chips, okay?
And Dr. Marks, let me ask you, can you get is the virus in the vaccine, and can the vaccine give you the disease?
Yeah, so these vaccines that we have, none of them involve the live or the killed virus. So you can't get COVID-19 from these vaccines.
Cannot get it.
Cannot, not possible.
Gerald.
Yeah. Excuse me, I didn't mean to cut you off if I did. I was wondering also, how often will we have to take this vaccine? Is it something like the flu? Will we do it every year, or is it a one-time thing? Like I'm vaccinated. Do I need to expect every time the variant or a new variant comes out, should I have to get another vaccine?
Peter?
Mr. Williams, you are spot on with one of the really, that's like they used to call it the $64,000 question. Now it's the $64 million question. We don't know for sure. We know that immunity tends to drop off a little bit over time, but it still looks like even after then, the body still has a pretty good idea of the virus. So we're not going to know probably until later this year whether we absolutely need booster shots. So unfortunately, right now, we're kind of in this period of saying we might need them, and we're preparing just in case we do need them. But we don't know for sure.
Good. And Dr. Clark, you and Dr. Fitzpatrick wanted to get in earlier. What's your comment?
Yeah, I just wanted to add about what's not in the vaccine. In addition to the fact there's no chips, there's no heavy metals or thimerosal or eggs in the vaccine, which are common things that people always ask and are concerned about. In addition, it doesn't interact with any medications that you might be on, because in addition to just that blueprint material, the instructions to make a small part of the virus, is just a fat molecule with a sugar and salt to stabilize that fat molecule, which acts as just a protective coating to protect that blueprint information so it can get into the body safely.
And Dr. Fitzpatrick.
Yeah, and I just wanted to add, we get a lot of questions about if it changes your DNA. Actually, the messenger RNA is only in your body for a short period of time. It's been likened to a Snapchat message, which is there and then it disappears very quickly afterwards. So people who are concerned about it hanging around and changing your DNA, it actually doesn't even come in contact with your DNA.
Say that again. Dr. Fitzpatrick, say that again. It does not even come in contact with your DNA. Everybody who's walking around with these theories and all this stuff about the fact that it changes your DNA, it doesn't even get to your DNA.
That's right. And then the final thing I wanted to say to add on to what Dr. Marks was saying about whether or not we need a booster, although we don't know the answer to this question, I can tell you one thing that will help us not need a booster is if we can control the spread of coronavirus, and we know how to do that. So if you don't want to get vaccinated, then wear your mask. If you get sick, stay away from other people until you're not able to spread it to someone else. We know exactly what to do to stop the spread of coronavirus. And if we can get the case rates down low enough, I don't think we'll need boosters, but it really depends on everybody doing their part.
And Robert, last question from you. What's on the minds that we have not? We have a lot of questions we're going to get to through the course of the rest of this evening, but we're going to close out this panel in a second and hit a few more issues and then come back and answer more questions. But is there something that is on your mind as a question or what you hear as you interact with your friends and colleagues?
Well, yes, and most of it is just getting back to and the fears that they're dealing with there. And we've been talking about just the mental health, just the anxiety that people are feeling right now about this prospect of coming back into the workplace. I think in the Washington area, numbers of people are coming back into the workplace. Traffic has really picked up. You see more people, and folks just have concerns. And so we're trying to encourage people to do things like, if you have an employee assistance program, if you need to talk with a health professional, mental health professional, please go do that. But we're also just a little concerned about management and workers working together and collaborating in the workplace. We've been fortunate in a lot of places where management has been willing to do that, and that's been a huge help, a huge relief to us. So we just want to kind of continue to encourage those things.
Great. Well, thank you so much, Robert, for those. It's so glad to have you with us, and we'll say goodbye to you, and we're going to keep our doctors. We're going to keep Jared for a minute because we're going to go into some parent issues. And I'm pleased to bring in now Dr. Samira Brown. Dr. Samira Brown has more than 10 years of primary care pediatric experience. She's the co-founder of Little Lives PPE and currently practices at Piedmont Healthcare in Atlanta, where she serves as the chair of the Physician Diversity and Inclusion Committee, and she is a proud member of the National Medical Association. Jared, you are a parent, and I know that from talking with you over time, you've got issues and concerns. What's the number one thing on your mind as a parent?
The number one priority, first, I got vaccinated myself so I could have my family safe. So that was the first priority. As a parent, you'll do whatever it takes, even if you're a little leery about it, for the love of your child. But when it comes to my child getting vaccinated, how safe is it? How safe is it for, I know you in the test periods, or actually you're getting kids out there 12 and up vaccinated. How safe is it for them, and also for kids that are younger? Because I have a child that's just going to first grade, and I don't know what that looks like with side effects and the cases being studied quicker than what I guess we would normally be used to.
So, Dr. Brown, I'm going to start with you and then go to Dr. Marks for how he made the decisions for approving the vaccines for kids 12 and up and so forth. But you're sitting there now talking to Mr. Williams. He's out there on the front lines. He's driving, the bus or operating the subway. People are walking all over the place, and now he's got to go home and he's got to talk to his kids. What's that conversation like? What are you saying to your pediatric patients and to their parents?
That's a great question, Mr. Williams. And first, I'd like to applaud you for getting, vaccinated yourself, masking while you're at work, and trying to be as safe as you can. Because certainly our concern for pediatricians, as pediatricians, is to make sure that children remain safe, right? And especially in our community. And so when you're talking about vaccines for children against COVID, currently Pfizer vaccine is indicated for children 12 years old and up. And the great news, it has been very safe so far. There have been no serious side effects that we have seen. And over 7.7 million children under the age of 19 have been vaccinated with the Pfizer vaccine. And again, it has been very safe and there have been no serious side effects. So as with any vaccine, we are always looking at safety issues. And certainly once you decide to vaccinate your child, we certainly hope that you will participate in the reporting of side effects that help keep the system safe through vSafe, which is a text-based survey, and also the VAERS system as well. But so far, it has been safe and extremely effective. So up into the 90s once they get that second dose of the vaccine.
So, Peter, take us into the room when you are making the decision with all of the advisory committees about whether to extend the recommendation for vaccination to children 12 and up. That must have been a pretty intense conversation and meeting. Why did you all decide to approve this vaccine for kids 12 and up?
So the data that went into that included a study that involved 2,260 12 to 15-year-olds, and they were randomized, flip of a coin, 1-to-1, to get the vaccine or to get a saline shot, essentially a placebo. And the vaccinated 1,000 or so individuals, none of them got COVID-19, whereas 16 of those who were not vaccinated did. And the immune responses in a portion of those, they compared the immune responses in a portion of the 12 to 15-year-olds to those who were 16 to 25. And if anything, the immune responses were better. And the safety profile was the same in the 12 to 15-year-olds as the 16 to 25-year-olds, and for that matter, the 25 to 55-year-olds. So the vaccine was safe. The efficacy was excellent. By way of full disclosure, people may have heard about this issue of some inflammation of the heart that's been very rarely seen. We don't really know if it's for sure related to the vaccine, but as was discussed by the Advisory Committee on Immunization Practices of the Center for Disease Control last week, the benefit of these vaccines greatly outweighs everything else. And I just have to take the opportunity to say the reason why it was a no-brainer for us is that some people don't realize that kids have been dying of COVID-19. They get an inflammatory condition, and it's not that common, but still, there have, as of mid-May, 380 children had died of COVID-19 in the United States. Now, that doesn't sound like a lot compared to the number of adults who have died, but anyone who's ever lost the child, and my sister lost a child, that's devastating. It's positively devastating.
Peter, let me ask you on this particular point, and I've looked at some of the data, but you know it better than I. This sort of inflammation of the heart that was noticed as very rare, it's even more common though when people have the virus. That the disease gives that much more often than any by far.
That's exactly correct. And the important thing to realize about this, which somehow it's gotten kind of lost in some of the noise, is that by and large, and my pediatric colleagues can probably say this as well. It's been one of these things that's been very mild, so mild, in fact, that you don't do anything and it just goes away. And so overall, no hesitation whatsoever to tell any parent to get their child vaccinated in the 12 and up range. We're still going to need to wait until later this fall and early winter when we have the longer follow-up data on younger children, because we really want to have more data on the youngest children. But for 12 and up, it's really important. And
let's really be clear on this point. This is such an important point because there are a lot of parents who want to know, when will my kids under 12 be able to get it? And what I hear you saying is, we always make decisions based on the data and on the science, no matter how much we want to hurry up and vaccinate our younger kids. And so what you are saying is you don't have enough data yet to make that decision.
That's right. We need to make sure that when we say that it's okay to give this to your 6-year-old, that we feel absolutely confident that the benefits of this vaccine are going to greatly outweigh any possible risks. So we're just going to need some more time to have enough 6-year-olds and 5-year-olds and 7-year-olds followed for long enough to feel really confident in that.
And let me thank you. And Dr. Brown, one of the things that Mr. Williams is concerned about, and he and I have talked about these issues over the last few days, is whether his kids should go have the sleepover, should they go to summer camp, should they play contact sports where you come in close intimacy with each other. What are you saying to your patients, and what are you saying to Mr. Williams?
Yeah, Mr. Williams, this is a great question. We definitely get this a lot. You know, now it's summertime, kids are out, they're going to camp, they're having a good time, and we want them to get that physical activity and get back, right, as close as they can to getting to normal. However, if your children are under 12 and they're over 12 and they're unvaccinated, our advice has not changed. They need to continue to social distance. You want to avoid those indoor areas if you can, so have them outside, space from others. Because as you were just saying, Dr. Tucson, when they're playing sports, they are mingled in together even when they're outside. So make sure that you are still masking. And that's really, really critical to make sure that children are still protected, because those under 12 are not able to be vaccinated. And the other benefit, just like you've already done, Mr. Williams, is to vaccinate around your children. So that too, your loved ones who, are coming to your home, make sure that they're vaccinated. If they're not, make sure that they're, masking when they're there, but really try to do those outdoor activities to protect them and continue to social distance.
So if we are loving parents, read the study, listen to the science, don't listen to Pookie giving all kinds of crazy information. Listen to the science, but you're saying loving parents get themselves vaccinated and the people around them vaccinated so our kids are protected. We're going to move to another section in a moment. And so Dr. Brown and and Dr. Marks, Fitzpatrick, and Clark. If you can stay around for a minute, we'll be coming back to you. But as we segue over, I want to make one thing clear. That was a question that we were receiving from the members, and that is, can the vaccines change my child's DNA? And I think we've hit that one pretty clearly earlier. No, it doesn't have anything to do with that. For Mr. Williams, thank you so much for joining us. I appreciate it, my brother, and I'll be in touch with you for sure. And now I'm happy to bring in Colonel Jacqueline King from the Federal COVID Response Team. Jacqueline King is responsible for a program that almost nobody knows about. But you may remember when former President Trump got ill, they threw everything in the kitchen sink at him and got him over it. And there was one particular drug that he took that has proven to be important, but that we don't know about it. And so we're going to make sure that every one of our workers has access to every tool in the armamentarium as we try to protect their lives. Welcome, Dr. King. And what is this drug that we are talking about?
Thank you so much, Dr. Tucson. This is such a wonderful opportunity to speak about something that not many people know about. And it's called monoclonal antibodies. And it is a treatment that's currently available for non-hospitalized patients. So it can save lives. So this is very, very important. So let me just talk a little bit about what a monoclonal antibody is. Well, a monoclonal antibody is an antibody or a protein that your body would, your immune system would make these proteins in response to infections and viruses. But sometimes your body doesn't produce immune responses to new viruses like the COVID-19. So what a monoclonal antibody is, it's a laboratory created protein or antibody that is specific for an infection. And in this case, it's specific to treat COVID-19. And if given very early on the onset of the disease, 5 days, but right now the cutoff is 10 days within symptoms, it significantly, the studies show that up to 80% reduction in hospitalizations. So thank you very much.
Wow. Well, let's make sure we got this now. So there is a drug, in this case, a laboratory produced antibody that if given in the right time for people who are infected and who have some significant issues of being infected, can stop that process from occurring. What is it when would you sort of recommend that someone, how would you know if you were a candidate for this, and how do you get access to it?
Absolutely. So it's currently the FDA has authorized the use of monoclonal antibodies for anyone over the age of 12. So similar to vaccines, it's not available to the very young right now. And it does require a prescription from a physician, and you have to have a positive COVID test. So it's very important for us to spread the word. So unfortunately, folks are still going to come down with this horrific disease. Vaccine is really the way to end the pandemic. But for those that are still being inflicted by COVID-19, and for those who have been vaccinated and unfortunately have not mounted a significant enough immune response due to an underlying medical condition like chemotherapy, these antibodies are treatment for them. So the one, you have to have a positive COVID test over the age of 12, get to your doctor as soon as possible. And if you are under 10 days of having symptoms, not under 10 days of having a positive test, but under 10 days of having the onset of symptoms, the IV infusion of monoclonal antibodies will be prescribed for you, and you'll be sent to a location that's currently offering the infusions.
So my loved one is now diagnosed, or one of my fellow workers in my on the job. We find out that they are positive for COVID, and they have symptoms. The guidance is to tell them, hey, call your doctor immediately, and certainly within the first 10 days. Is that right? Call my doctor, your doctor, and your doctor then, and say to them, I want you to be evaluated as a candidate for one of these monoclonal antibodies, and then they will be sent to a place to be able to get this therapy. Do you have to pay like money out of your pocket right then?
Similar to the vaccines, there's no cost. So the monoclonal antibodies are available throughout the country at no cost. There is an administrative cost, but for patients, we're telling them they're at no cost to you. We also have set up increase in infusion access across the country. So, but it is important. I did mention that they're available now for anyone over the age of 12, but the high risk criteria I'd like to point out include over the age of 65, pregnancy, being overweight, having chronic kidney disease, and having some neurodevelopment disorders like cerebral palsy. But the FDA also recently has expanded that eligibility criteria to allow the prescribing physician who knows their patients best to authorize that almost any patient over the age of 12 could be a candidate based on other socioeconomic factors if they feel that they are at risk for developing significant comorbidity to the disease. Okay. So bottom line, it's available at no cost to you, but you have to get to your doctor under 10 days. I'd like to share some information with the group on access. I encourage everyone to visit combatcovid.hhs.gov for more information. We also have an infusion site locator, so you can put in where you're located and it will bring you to the nearest infusion site. And we also have a call center available in English and in Spanish, and that number is 1-877-332-6585 for English and 366-0310 for Spanish. So please get the word out. It's very important. Not many people surprisingly know about monoclonal antibody treatment. The IV infusion is not, it's gotten down to 20 minutes. You do need to be observed for an hour, just like with vaccines, you could have an allergic reaction. And the FDA has now authorized different administrations, such as subcutaneous route. So we're making it easier.
Thank you. So our producer, Ellis, has put in front of us that website, and if there is another piece of information you mentioned, I'm sure you will get that into the chat before as you sign off. Thank you so much.
Absolutely,
you're great, and I know that you kept mentioning the FDA, and Peter was nodding his head, so it sounds like we have agreement. But I think the key message you also gave, and we want to make sure we get it right: get vaccinated, and you don't have to worry about it. If you don't get vaccinated and you get ill, this is an opportunity. It's an important opportunity, but it does not by any way, shape, or form mitigate the importance of preventing it in the first place. Thanks so much, Dr. King.
That's correct.
Now we have a very important part of our conversation that we need to deal with. And this particularly is high on the list of issues for our workers. And that's the issue of mandatory vaccination. I am very, very pleased that we have with us Attorney Dorothy Singletary from the Service Employees International Union. She's a law fellow there. And also we're bringing in, I think he's maybe with us now, is Dr. Cameron Webb, who is the Senior Policy Advisor for COVID-19 equity with the White House. Let's start with you, Dorothy, and thank you so much for joining us. A lot of people are wondering, what about, and by the way, as for those of you that are listening in, we're going to come back after this section and keep hitting the answers to your questions. That's why all of our physicians are standing by. This is your program to answer your questions. So, but I know one of your main questions is, what about mandatory vaccination? Attorney Singletary, what do we need to know?
Yeah, so the Equal Employment Opportunities Commission actually recently issued guidance providing that employers may mandate that employees who physically enter the workplace must be vaccinated. Additionally, employers can also require that employees must provide them with either documentation or confirmation that they have been vaccinated. And so it's also important to note that even though this is federal guidance here, that there have been several states as well. There have been several states that have proposed legislation that would either outright ban or even limit the scope of employer-mandated vaccines. So if you are in a union, it's great to talk to your union, as well as talk to any other type of representative that can help you kind of navigate the legal landscape. Another important thing to note as well is that there have been several lawsuits filed by employees against their employers who have mandated the vaccine. And so we're actually just got a recent decision out of a district court in Texas, which actually they sided with the employer who mandated that that the employees have to take a vaccine. Of course, this was in a healthcare setting, and we're actually still kind of keeping track of whether or not there will be more decisions on whether or not employers can actually mandate the vaccine. But as of right now, there is federal guidance saying that they can. I think lastly, it's also really important to note too, that even if your employer does mandate that you must have the vaccine, it's also, you may ask them for a reasonable accommodation. So what do I mean by reasonable accommodation? I mean that if you are a employee who has either a disability or have a sincerely held religious belief that prevents you from getting vaccinated, then you can speak with your employer about, what issue prevents you from getting vaccinated. And from there, they must provide you with a reasonable accommodation, unless it will be an undue burden on your employer. And by undue burden, I mean it would be a significant expense, or it would be a significant burden on your employer to implement such a reasonable accommodation. And so some accommodations that the EOC has actually advised employers to provide include teleworking if feasible, modifying your work schedule, or even also modifying your workspace. So maybe implementing social distancing measures for you, as well as providing some type of PPE to protect workers who are unable to get vaccinated. So those are the top lines.
One of the things that I hear, or I thought is a major part of the mandatory vaccination issue, is whether or not the FDA and Dr. Marks and his colleagues move from emergency use authorization, which is where we are now, to full-fledged FDA approval. Is that a significant factor remaining in any of these decisions about mandatory vaccination?
Yeah, I do believe that is still a significant factor. However, as I stated before, employers can mandate that that people get vaccinated, even though these vaccines only currently have emergency use authorization. However, we believe that especially in the fall, when they do get full authorization from the FDA, we are definitely going to see an uptick in the fall of employers mandating that people get vaccinated. So that's definitely something to watch as well. I think that's why a lot of employers haven't necessarily jumped out to mandate that employees must be vaccinated. But I think once full authorization happens, we're going to see a big uptick of that.
Let me bring my friend, Dr. Cameron Webb, in. We heard earlier from Dr. Marcela Nunez Smith. She and Dr. Webb are really almost joined at the hip as being our representatives from the White House. They do everything that they can do 24 hours a day, 7 days a week to help fight this pandemic. We just love them so much. Dr. Webb, I first of all think that you have a background in the union movement, if I recall properly, but you may want to share. But what is your perspective on this mandatory vaccination? And in particular also, Dr. Webb, any thoughts from the administration on how people will be able to prove that they have been vaccinated?
Yeah, definitely. Well, thanks for having me, Dr. Tucson. It's great to be with you. And I think just by way of background, I used to work for the Service Employees International Union. So shout out to 1199, good folks out there, and did some organizing with them about a dozen years ago now. Hard to believe. But in any case, I think the conversation around vaccine verification is a really important one. And I think that, we've been pretty clear from the administration side of things that there's not going to be any kind of federal vaccine registry or any federal mandate for vaccine verification. We know that this is a really contentious issue among the states. We've got over 18 states that are saying absolutely not. We've got 3 states in New York, California, and Louisiana, I believe, who are allowing these sorts of things. And I think that if you look at it across the board, employers are, making decisions for themselves. Does this serve their interests or does it not serve their interests? In different geographies, you're going to see different dynamics. But what we've said pretty consistently is that the merits of vaccination really sell. The merits of vaccination being that it protects you from hospitalization, protects you from death. And if you're vaccinated, you're protected. And if you're not vaccinated, then the guidelines are clear. You should be wearing a mask. You should be maintaining distance. You should be, following those mitigation measures. And so I think our approach to it is that we're just leaning into the data that we do have, the value of the safety and efficacy of these vaccines, and then we're allowing businesses to make those decisions, private businesses to make those decisions for themselves. And you heard the reference to Houston Methodist, really, I think a really important case that we've seen kind of play out or starting to play out. And that's that, in healthcare settings, we're going to see these sorts of things. We're going to see healthcare providers saying, we've got a compelling interest to, keep folks vaccinated. And you're going to continue to hear this conversation move forward once there is full approval of these vaccines. And so there's still a lot that's in flux, but I think the key here is that from a federal standpoint, we're not going to be mandating vaccine verification on any specific platform. And again, all of this is still under development.
Thank you so much. Attorney Singletary, what about if an employer requires workers to be vaccinated, should then the employee be paid for the time and the effort to get vaccinated? What's your opinion on that?
Yeah, so underneath the Fair Labor Standards Act, we believe that if your employer mandates you to be vaccinated and you need to take time off in order to get vaccinated, then you should be paid for that time off. So that's our stance.
And one last question for you. Does one of our union members is asking this question: does my employer have to implement any safety precautions to protect coworkers and me from COVID-19?
Yeah, so that is a great question. So underneath OSHA's general duty clause, it provides that employers must keep the workplace free of any recognized hazards that may likely cause serious injury or death. And so OSHA actually recently issued some voluntary guidance for employers and employees in non-healthcare settings. And so in that particular setting, it does provide that employers do not have to take any type of precautions to protect workers if everyone has been fully vaccinated. However, in work settings where there are workers who have been unvaccinated, they advise workers to implement some type of health safety precautions, such as providing them with masks, implementing social distancing measures, and giving time off to get vaccinated. Additionally, OSHA also recently issued a emergency temporary standard that provides that, and applies to a healthcare setting, so employers and employees in healthcare settings. And there it basically provides, I would say, higher protections in which it mandates that employers must provide them with PPE, that they implement social distancing measures. Additionally, they have to follow certain guidelines when they're disinfecting the workplace.
Well, Attorney Singletary, thank you so much for joining us. That's just what we needed to hear, that information. You have been just perfect. Have a great evening. And now we turn to our physician panel. And this is, ladies and gentlemen, the lightning round, where we are going to try to answer as many questions as we can in the next 7 or so minutes. And let me just sort of start out with Dr. Webb. Do I need to get vaccinated if I've already had COVID-19?
The recommendations are that, yes, you should still get vaccinated. The data on natural immunity is that it doesn't last as long as the data that we have for immunity that's conferred from vaccination. So the other thing is that we know that the effect of vaccination against the variants is really strong, really solid. So great data there, especially with the Delta variant on the move and increasing in frequency. So the answer is yes.
Josh Williams, are you available to come in? Josh Williams, who is the esteemed labor leader in Washington, D.C., the dean of the Black labor movement in Washington, D.C. Josh, I think you have a question to ask.
Yes, I do. And I'm not quite sure about that title about dean of the Black labor movement, that there is an age connotation to that. And I'm not quite sure I want to admit to. But thank you very much and good evening, everyone. Dr. T, I've been having some trouble getting on, and so I do have some questions, but if they have been already asked, please let me know, and I'll just kind of moved on. Is one question, if it has already been addressed, is to the panel, and that is, why are people who have only achieved one vaccination are included in the group of quote unquote 70% or whatever it is that the president is trying to achieve? It seems to me that if you're either fully vaccinated and you're not, you can't be half vaccinated. It's like saying that you're half pregnant. So which is it? Are you fully vaccinated or are you vaccinated?
Great question.
It's nice to see you, Mr. Williams. I also would welcome Dr. Marks to chime in on this, but the truth is you actually have some protection from the first vaccination, and it's actually pretty good protection. So when you come behind with the second vaccination for that added protection, you're considered fully vaccinated. But if you've only got one shot, after a couple weeks, you actually have a good amount. You're not just flying out there with no protection whatsoever.
Any additional comment?
Yeah, if I can,
I'm sorry, who's that?
this is Dr. Clark. I just wanted to quickly add, though, with the Delta variant, we are seeing some studies out of the UK that shows unless you have both doses of the Pfizer, and they also looked at AstraZeneca, you're kind of out there not well protected from the Delta variant, only about 30%, pretty low. But if you have both doses, you're 90% protected. So really would urge everybody, if you haven't gotten your second dose, please go ahead and do that. This is a great time to do it.
I saw you shaking your head affirmatively, Peter.
I couldn't say it better than Dr. Clark, so I'm not going to.
Next question, Josh.
Well, can I just follow up on that? So policy-wise, shouldn't we be dropping those people who've only received? Why do we keep insisting? Aren't we sending the wrong message to people who have only had one vaccination? That it's okay for them if they are in the group and they can mix with people.
Cam?
At what point do they stop? At what point have they dropped out?
Just to speak up for Dr. Marks and my boss, so there are a couple of goals with regard to July 4th. So the first is 70% of adults with at least that first shot, and Dr. Fitzpatrick and Dr. Clark kind of spoke to that. But there's also a goal of 160 million people fully vaccinated, and that doesn't get the same big headlines, even though he announced it in the same breath. So I think that, we do have goals around full vaccination as well. And so, and the other part of it is from a data standpoint, there are a lot of people who get that first shot in one location and they're recorded, but they get their second shot somewhere else. So for instance, they can go to a mass vaccination site for their first shot, or at their church and then get their second shot at CVS or Walgreens. And so we lose some of those people. It doesn't mean that they didn't get their second shot. It just means that it wasn't in the same location. So it takes the system a little while to catch up. And so I think that's why the most accurate number that we have are people who've initiated the series, understanding that the great majority of people who get a first shot are able to get set up and go get that second shot as well. But again, some of it's just crosstalk in the system.
All right, let's make sure, folks, get both doses. There's no fooling around here. Before I go back to you, Josh, for your next question, I want to throw one to Dr. Brown, who is a pediatrician, but I bet you she has some thoughts from even the OB point of view about pregnant women getting the vaccine. Should they, can they, and can breastfeeding women get the vaccine? Thoughts,
Yeah.
Dr. Brown?
Thank you, Dr. Tucson. We would definitely recommend that both pregnant women who are at increased risk for complications of COVID-19 and also breastfeeding mothers, that they all get vaccinated. And it has been shown to be safe thus far. And so we definitely highly recommend that. And it's a great way to protect that newborn that's coming.
And Dr. Marks, for you, and then I'm going to turn back to Josh for his next one, but right on this theme of pregnancy, is it safe for me to get a COVID vaccine if I would like to have a baby one day?
So,
and by the way, that's a question from somebody else.
Yeah. So there is no reason, whether you're male or female, or that you should not get a COVID vaccine. That is not going to change your ability. It does not have any effect on fertility. It does not affect your genetic material that you can pass on to your children. And if you want to have a child, the best way to stay alive to have that child is to get vaccinated. So it's a good idea to go ahead and get vaccinated.
And by the way, since you opened up that door, I got to turn to my brother, Dr. Webb. You kind of intimated one of the issues that a lot of the brothers have out there. Dr. Webb, does the vaccine have anything to do with messing with your function?
No, it doesn't. It doesn't. And again, I think the idea of fertility or reproductive health, this is a common trope. We've seen people use that frame to deter people from vaccination really all over the world in so many different settings. But you do have to go back to the science and you have to go back to the data. And we have no reason to believe that it does. Again, we've got about almost 180 million people who've had at least one shot of these vaccines. And trust us, I heard Dr. Brown earlier talking about theirs. We would know, right? If there was some, large percentage of folks who are having issues, with fertility or with the ability to get or maintain an erection, right? Just to be frank, then you would definitely have heard about that. That would be a real issue. It's just dis and misinformation that's going around, and that's why we have to be really clear about it.
And there was a study done out of University of Miami published last week. 45 men, they looked at their sperm counts after vaccination. None went down, a few went up. I don't know that we could credit the vaccine with it going up, but clearly it does not have a negative effect on sperm count. As a matter of fact, COVID-19 actually can affect the actual disease, can affect can cause erectile dysfunction and can cause decreased sperm count.
There it is. You heard it here, folks. We cover every topic known that we can possibly cover. Josh, what's the next question from you?
This one came in from my union member. It may not pertain to the topic tonight, but I'll throw it out to you and Dr. Webb. The union member said that she heard about the barber program and beautician. Went to her beautician, the beautician was not participating and did not know about it. And she wants to know, is the program still running? Are beauticians and barbers still on? And if so, what are we doing to get the word out?
Well, let me set it up. And this is a great one for sure. And then flip it to Dr. Webb really quick. But the president of the United States, about 2 weeks or so ago, had a press conference. And he asked that the Black Coalition Against COVID take a leadership role to help his administration to reach out to barbers and beauticians, because so much of the culture of our community is lived in those chairs, and we want to make sure we train them. So Dr. Webb, just a quick sense on that program, and we will put in the chat the information for people who want to have more information.
Yeah, no, great question. So there are really 4 collaborating organizations that are a part of that Shots at the Shop initiative. And that's going to be the Black Coalition Against COVID, which Dr. Tucson just mentioned, the University of Maryland Center for Health Equity that provides trainings to shops to do this work. And then the personal and beauty product company Shea Moisture, who started a $1 million fund so that 1,000 barbershops and beauty salons can get $1,000 each in order to do vaccine education and vaccine administration as we're pushing toward the president's goals. And so what's going to happen there, we're already at just under 900 shops registered. So yes, it's still going on, but if you know some shops that are interested, I really do believe we're probably going to be out of spots in terms of getting the $1,000 from Shea Moisture, within the next couple of days. So definitely encourage them to participate. We've been really focused on getting the word out, particularly in communities that have a large number of folks who are still not vaccinated. And so that's why we've got over 60 shops in Alabama. We've got a lot in Mississippi. And so we're really trying to focus in on the places where this can do the most good. But as Dr. Tucson said, barbershops and beauty salons, those are great equalizers, places where truth is the norm. And so we want to make sure that we're leaning into those spaces to provide this information.
Would you please, Dr. Webb, just slip the address in for people that want to register? Dr. Marks, quick, again, we are really in lightning round now. Should people with allergies get the COVID vaccine?
As long as they're not allergic to one of the components of the vaccine and people can find out what those are, they should get this vaccine. They just tell the doc or the healthcare provider, the nurse, anyone who's given them the shot that they have the allergies, and by and large, they can generally be vaccinated.
So people with chronic medical conditions get the vaccine, Dr. Marks?
People with chronic medical, those are the people who really need to get the vaccine. They should get the vaccine. Those are the people who may benefit some of the most from getting the vaccine.
And what about immunocompromised people on chemotherapy and those sort of things?
Right. They can talk to their docs, but generally, I'm a cancer doctor by training. I would tell most of my people to get the vaccine at the right time related to their treatment. But it's important for them to get vaccinated. They may not have quite the same response as a person who's not on chemotherapy, but it's better to get some response than have no response.
Great. Dr. Fitzpatrick, what are the side effects of the COVID-19 vaccines, and are they serious?
Well, some people don't have any side effects whatsoever. And everyone's going to respond in a different way. You can have chills, you can have fever, you might feel a little achy, you might feel tired for a day or two and just want to sleep and rest. But I think those symptoms, I'll take them any day over having COVID-19.
Dr. Clark.
And if you have had COVID-19 already, you should still take the vaccine.
Right. Yes.
So great. That's important. If I'm exposed to COVID-19 after I'm vaccinated, do I still have to quarantine, Dr. Clark?
No, unless you feel symptoms, you should get tested, of course, but you don't have to quarantine if you're exposed and you're already vaccinated with both doses of Pfizer and Moderna, and your one dose, of course, of the Johnson & Johnson vaccine, which is only one dose.
Well, we have exhausted our time. It is exactly 8:45. I want to thank all of you for answering so many of the questions that our union colleagues have broached to us. As we end up, I think it is a message that we have been trying to relay all evening. To all of you workers out there, you are essential. You are important. We at the Black Coalition Against COVID care about you. We love you. We want you to be safe. We want your families to be safe. We want your communities to be safe, and we want your workplace to be safe. If you have questions that we have not answered, be sure to go to trusted sources like the Centers for Disease Control. You've heard from one of their leaders here tonight. Go to your physicians like the ones we've had on this panel, who will be prepared to answer your questions. But it is much better to ask questions when you're unsure and get the answers than it is to sit back and continue to be hesitant. The time is serious. We need to close this gap in immunization for our community. Otherwise, this is going to have a continuing devastating impact on the Black and minority community. We do not want to see that happen. As we end this great evening, I definitely want to come back and just really, really give a note of extraordinary gratitude to our co-sponsors, SEIU, AFGE, AFSCME, USW, AFL-CIO, DC, CBTU, UFCW, and Unite Here. They have been wonderful partners, and their partnership for this shows how much they care about their members. As we close out, I want to end with the video from President Kelly, which I think is very compelling. And again, another example of union leadership and concern for members. And then after that, a little video from Made to Save. For all of you who have participated in this program, thank you very much. Ellis, run the video.
Coming to you with an important message. Government workers have been serving on the front lines of this COVID-19 pandemic since the spring of 2020. Unfortunately, in that time, we lost hundreds of AFG members to this deadly disease. That's why it's so important that each of us take this opportunity to get vaccinated. I was overjoyed to get my shot in March of 2021 when the vaccine first became available in my area. Now nearly everyone in the United States is eligible to get vaccinated. Thanks to the many people who have already taken advantage of this life-saving vaccine, things are starting to return to normal in our country. We just got to get over the finish line. So if you haven't already, please get vaccinated, AFGE. Thank you.
Outstanding. Thank you all. Have a good evening.
COVID's put life on pause for so long. I'm all about protecting what's mine. So when my doctor says COVID-19 vaccines are safe, effective, and taken by millions, I can trust that. And now that everyone 12 and older is eligible, I'm talking to friends, family, everybody about the real facts and how they can get vaccinated. Life is waiting. Let's press play and get on with living again. We can do this.